See warning labels on packs of cigarettes. Well, now the U.S. Surgeon General says social media should carry warning labels as well. It would warn parents about the significant mental health harms for adolescents. Dr. Vivek Murthy has long indicated his view that social media poses a health risk to kids and teens. In a New York Times op-ed, he likens a warning label on the technologies to those appearing on tobacco and alcohol products. Though the nation's top doctor, called for these warning labels, it's going to get them will require an act of Congress. Meta, the parent company of Facebook and Instagram, did not immediately respond to requests for comment.
All right, Kelly, we want to talk a little bit more about this. So joining us now is Amanda Woodard, a licensed professional counselor, specializes in working with young people that are affected by social media who might struggle with suicidal ideation. Thanks so much for being with us. We appreciate your time today.
Of course, I'm glad to be here.
So when you heard this news today, what were your thoughts?
First, it was amazing. Dr. Murthy has worked really hard to be an advocate of regulations for social media, making sure that there's restrictions, making sure there's transparency. And today's call to Congress to say, let's put a surgeon warning general on the social media apps, I think is absolutely necessary. Parents need to be aware of the detrimental effects that this can have on teens.
Let's talk about that. You know, we've often heard that it's a dangerous road for kids to go down, especially for young kids. Why is this? Why do you think that is?
The research tells us that if a teen spends more than 3 hours a day on social media, that they are twice as high of a risk for depression and anxiety. And we know the average teen spends about 5 hours a day on social media. So we know that we're seeing, the research is saying, this is why we're seeing increased anxiety. This is why we're seeing increased depression. We know that in Colorado, we have a really high risk of suicide rates. Last year in 2023, we lost 166 Colorado residents under the age of 24 that died by suicide. So to me, we need to be aware of what's going on, and we need to start regulating it and paying attention.
You have a son going into 8th grade, I think. And so how do you implement and stay true to what you believe and what you see with research with your own child?
Yeah, he's one of the only teens at his school that does not have a cell phone and still does not have a cell phone. And a lot of parents ask me, like, why is that? How come he still doesn't have one? Isn't it difficult, right? Yeah, it's difficult. It's not convenient to be able to talk to him. At the same time, I think our duty as parents is to keep our kids healthy, and that means physically and mentally. And that means me protecting him from the social harassment, the bullying, the endless comparison that we see, and the detrimental effects that it can have. And he kind of is a whatever mom kid now, like, okay, I've seen it. In the 10 years I've been doing this at my practice, Original Path Counseling, I've specialized in suicidal ideation. He's seen the effects of it. He sees his friends glued to his screen. He gets it.
He gets it.
Yeah.
Well, thank you so much for your time. We appreciate it. And a deep dive into this. Of course, we wish we had more time, but thank you so much, Amanda.
Thank you.
We have a red flag warning going on for